Hello, this is Dr. Goyal. In this video, I'd like to explain to you the procedure we completed, what to do after the procedure, how the recovery is going to be, what your experience is likely to be. Myself and Andy will be talking to you about some of the aspects that are important to you after the procedure. So here's what was done today. We put a catheter in your right groin and went up a blood vessel into your heart and were able to successfully deliver the Watchman device in the left atrial appendage. Subsequent to that, we removed all the equipment that was placed inside. We gave you general anesthesia. Now I'll talk to you about what would happen immediately after the procedure. Immediately after the procedure, we take you over to the recovery room, which is right next to our procedure room. In the recovery room, our nurses will make sure you're stable, your breathing has returned to normal, your blood pressure is fine, your heart is doing well, and then transfer you to another room for further monitoring. We should ideally be able to let you go home in about 6 hours after the procedure. At that time, we just monitor, making sure there are no complications from the procedure, that you've recovered well. You should be able to eat after the procedure. If you have groin pain, please let us know. That again can be managed with medications. They'll have you walk about an hour before you go home and make sure you're stable.
When you get home after your procedure, take all your medications like you normally do, unless you have been instructed otherwise. That evening and during the night, stay in bed, only get up if you absolutely have to, and please do not strain. Next morning, you can get up, walk around gently, no straining, nothing strenuous at all. The second morning after your procedure, you're allowed to drive if you feel up to it. Activities such as golf, swimming, going to the gym can be resumed a week after the procedure if you feel up to it, if you feel your body will allow you to do it. Avoid lifting anything greater than 20 pounds for 2 weeks after your procedure. Before a Watchman, we prefer patients to be on an anticoagulant, but it is not required. After the Watchman, patients are put on Plavix, which is a different type of blood thinner, and they're put on a baby aspirin as well. The prescription for Plavix will be called in after the procedure, and then the baby aspirin, 81 milligrams, is over the counter. The previous anticoagulant is discontinued.
Hello, my name is Shatavia. I am Dr. Gold's scheduler. So if you need any appointments, any information about the procedures, you can call me at 352-751-3356, extension 3312.
Hi, my name is Veronica. I am Dr. Goyal's medical assistant. If you have any clinical questions Monday through Thursday, please call 352-598-5507. And any medical or clinical questions on Friday, Saturday, or Sunday, you will need to call the main office at 352-751-3356.